Patient has a nice even gait with easy movement and good posture. Handshake was firm, eye contact was established. I introduced myself to the patient, asked her why she was seeking care, told her I'd be assessing her reproductive and breasts, and checked her armband for identification. The patient hears and understands me when I speak English, has no issues with vision, can sit, stand, and rise with ease, dressed appropriately, interested and involved with her care, mentally alert, and I can tell because she's able to verbalize 3 unrelated objects such as dog, box, and couch, and she is oriented to time, person, and place. Patient has no signs of shortness of breath and appears to be of healthy weight. Have all my proper equipment: tongue blade, reflex hammer, tuning fork, full socks, cotton ball, temperature probe, scent for the olfactory nerve, and blood pressure cuff. For history, I'll get the patient's biographic data by asking name, date of birth, occupation, gender, and marital status. I will get her reason for seeking care by asking her chief complaint, and history of present illness by assessing that chief complaint using old cards. I will get present health information by asking about present medical conditions, allergies, medications taken. I will get present health information by asking about recent surgeries, hospitalizations, accidents, immunizations, last exam, childhood illnesses, and obstetric history. I will get family information by asking about chronic conditions that may run in the family and social relationships. I will get personal information by asking about personal status, illicit drug use, smoking, diet, environment, and functional ability. I will get psychological information by asking about health promotion, mental illnesses, and then I will do a review of systems by getting general symptoms along with integumentary, head and neck, chest, breast, respiratory, cardiovascular, GI, GU, reproductive, musculoskeletal, and neurosystems. I'll get vital signs by taking the patient's temperature, blood pressure, pulse, and pulse ox. Respirations. Height, I will have her verbalize. Weight, I will use the bed scale. Visual acuity, I will use my Jaeger Snellen chart. And I believe that's all for vitals. I will then prep the patient for the exam, asking her if she needs to go to the bathroom, collecting any specimens if needed, and giving her a gown to change into. For the focus assessment, I will inspect the patient's breaths for size, symmetry, and shape, and then I will palpate breast tissue. Inspect the areola for color, shape, and surface characteristics, and inspect the nipples for position, discharge, lesion, symmetry. Inspect the axillae for enlarged lymph nodes, lesions, masses, and then inspect labia majora, which is the outside, labia minora, which is the inside, and clitoris, which is at the top. Looking for surface characteristics and lesions. I will then inspect the perineal area and anus for lesions and surface characteristics, and then assess the anus for sphincter tone and surface characteristics after I put on gloves. After that, I will move on to my head to toe. When I'm taking pulse and blood pressure, I will be inspecting the hands for skin characteristics, temperature, and moisture. I will be inspecting symmetry, testing calf refill, and inspecting and palpating the nails for cleanliness, clubbing, contour, consistency, color, shape, and thickness. Moving on to the head, I will inspect the skull for contour, Inspect hair for color distribution. Palpate the hair for texture. Palpate the scalp. Palpate temporal pulses. Inspect facial features and symmetry. Inspect bony structures of the face for size, symmetry, and intactness. Evaluate the sensitivity of the forehead, cheeks, and chin to light touch. Inspect skin for color and lesions. Complete an assessment of the cranial nerves. So for olfactory, I will have the patient close her eyes and mouth and identify a scent that's placed in front of her. For optic, I will use the Snellen chart, and I will test peripheral vision by standing in front of the patient, moving my arms, asking when she can see the movement of my fingers. For ocular motor, I will go up and then down, and down will also test trochlear. So up, ocular motor, down, ocular motor, and trochlear. And then sides will be abducens, going out, and going in will be ocular motor, it's going in. For trigeminal and facial, I will use the corneal reflex, touching the cornea with cotton to make sure that there is bilateral blinking. And for acoustic nerve, I will use the Rhine test, putting it on her mastoid process until she can't hear it, and then moving it to the front of her ear. And then the Weber test, I would put on the top of her head, right in the middle, and ask which ear she can hear it better in. For glossopharyngeal and vagus, I will test the gag reflex, assessing that there is one, and inspect soft palate movement when the patient says ah. I will test the spinal accessory nerve by pushing on the patient's shoulders when she shrugs, and the hypoglossal nerve by having the patient stick her tongue out, move it from side to side, up and down, looking for symmetry and lesions. To finish the head and face, I will palpate skin surfaces, facial bones, and sinus regions, making sure that I inspect skin for color and lesions. Then for eyes, I will assess near and peripheral vision with the Jaeger and Snellen chart. I will inspect eyebrows for color, distribution, underlying skin, and symmetry. Inspect eyelids and eyelashes for blinking, closure, color, position, and symmetry. And then inspect the conjunctiva and sclera for color and clarity, and the cornea for transparency. For the ears, I will inspect external ear, palpate external ear, inspect auditory canal, and then palpate lymph nodes of the head. For nose, mouth, and oropharynx, I will assess nasal structure and septum, assess the nose for patency, symmetry, and discharge, and the lips, buccal mucosa, and gums for moisture, symmetry, texture, and color. I will assess teeth for number, alignment, hygiene, color, condition, position. I will assess the floor of the mouth, hard and soft palate. For color and lesions, color and surface characteristics, I will assess the oropharynx for odor, anterior and posterior pillars, posterior pharynx, tonsils, and uvula, and then assess the tongue for symmetry, surface characteristics, movement, and color. Then I'll move to the neck, observing symmetry and smoothness of the neck, trachea, and thyroid. I would observe the neck for range of motion and palpate carotid pulses one at a time. I will auscultate for bruits. Palpate lymph nodes of the neck, and observe for jugular venous distension. Then for upper extremities, I would inspect the arms for surface characteristics, symmetry, and deformities. I would palpate arms, elbows, and wrists for temperature, tenderness, and deformities. And then I would palpate radial or brachial pulses for presence and amplitude. For posterior chest, I would observe posterior and lateral chest for shoulder symmetry, muscle development, scapular placement, spine alignment, and posture. I would inspect the skin for color and surface characteristics, such as lesions, scars, intactness, and color. I will palpate the vertebrae for alignment and tenderness, observe respiratory movements for depth, excursion, symmetry, and rhythm of respirations. And then I would palpate posterior and thoracic muscles for tenderness, bulges, and symmetry. Then I would palpate chest wall, posterior chest wall for thoracic expansion, palpate down the vertebral column for alignment and tenderness, percuss the costovertebral angle, and then auscultate posterior and lateral chest walls for breath sounds. I will do 10 on the back, and then 7 on the sides, 2, 3, 4, 5, 6, 7. Then for anterior chest, I would auscultate anterior chest for breath sounds. There'd be 8. And then I'll auscultate the heart for rate rhythm, S1, S2, lifts, intensity, frequency, timing, splitting, S3, S4 are murmurs. So there's 5 spots there. For women, I would inspect breasts for breast or nipple deviation, contour, surface characteristics, size and symmetry. I would inspect breast symmetry of the tissue during movement by having the patient put her arms above her head, behind her back, and then putting her hands together tightly leaning forward. For males, I would inspect the breasts for lesions, breast enlargement, nipple drainage, size and symmetry. For all patients, I would palpate lymph nodes associated with drainage of the axillae and breast. I would assess the anterior chest in a recumbent position, having the patient elevate their head at a 45-degree angle to inspect for jugular vein pulsations. And then I would palpate anterior chest for thrills, heaves, and pulsations. I would then put the blanket over the patient's legs and go to the abdomen, observing surface characteristics from pubis to mid-chest, inspecting for scars, lesions, vascularity, bulges, and navel. I would observe for abdominal movement, peristalsis, and pulsations. I would inspect for abdominal contour. Auscultate all 4 quadrants for bowel sounds, venous hums, and bruits. Lightly palpate all 4 quadrants for tenderness, guarding, and masses. And then have the patient raise her head, evaluating flexion and strength of the abdominal muscles. For lower extremities, I would inspect legs, ankles, and feet for skin characteristics, vascular sufficiency, hair distribution, and deformities. I would palpate lower legs, feet for temperature, pulses, tenderness, and deformities. I will test range of motion, motor strength with pushes and pulls on the feet, and sensation of hips, legs, ankles, and feet. And then I would test deep tendon reflexes, which are patellar. Then I would do the other side. Achilles, and then I would do the other side. And then to make sure I'm getting all my deep tendon reflexes, I would go back to the arms, doing brachioradialis. Brachial. And the third one. For neurologic system, I would observe the patient moving from a recumbent to sitting position, noting use of muscles, ease of movement and coordination. I would assess gait, observing and palpating the spine. For alignment, as the patient stands and bends forward to touch her toes, I would evaluate hyperextension by having the patient bend backwards, lateral bending by bending to the side, and then rotation of the trunk. For fine motor functioning and coordination of upper extremities, I would have the patient alternate from pronation to supination, touch her nose with alternating fingertips, and then to assess cerebellar and motor functions, I would have the patient walk heel to toe, stand on one foot with her eyes closed, and then stand on the other. Then for genitalia, pelvic, and rectum, I would have the patient lay on her left side, which she doesn't want to do right now. Bend that right leg and knee, and perform a rectal examination to assess anal sphincter tone and surface characteristics. I would put gloves on, and then note the characteristics of stool when I remove my lubricated finger.